Health Systems Administration at Georgetown University. My research and scholarship is at the intersection of public health, systemic racism, and healthcare delivery. Indeed, it is a pleasure to serve as moderator for this session. We have convened an esteemed panel of 4 experts, each working in different spaces that we know are critical in our journey towards health equity. Government agencies represented in this discussion include the Department of Employment Services, DC Public Schools, and the Department of Human Services. We've also included one of the city's most cherished nonprofits, the Latin American Youth Center. Yes, so good to see you. Our goal for this session is to reflect on lessons learned from the COVID pandemic and uncover opportunities for radically changing how organizations operate both internally and how they collaborate with key partners for collective impact. We only have 50 minutes. We have a lot to accomplish. We'll wrap up at 2:20. Feel free to ask questions in the chat, and I'll reserve the last 10 minutes to allow panelists to respond. So I'd like to begin by asking each panelist to briefly introduce themselves and share a little bit about the mission of the organizations that they are representing. So why don't we start with Dr. Morris-Hughes.
All right. Well, good afternoon. My name is Morris-Hughes, and I am the director of the DC Department of Employment Services. And at the DC Department of Employment Services, we're really tasked with several different things. I like to consider us economic first responders, where we are focused on bringing critical economic benefits to DC residents and DC workers. We also run a pretty elaborate and large worker safety and benefits programs. So from workers' compensation to paid family leave, to labor law enforcement and everything in between. And then we run a pretty robust workforce development arm, providing critical training resources to the community so we can make sure that DC residents are prepared and competitive candidates in this labor market and economy.
Thank you, Dr. Morris-Hughes. Dr. Laura Zeilinger. And if I've mispronounced your name, please correct me.
No worries. So hi, my name is Laura Zeilinger, and I'm director at the DC Department of Human Services. And I like to sum up our mission at DHS is that we are on a social justice mission. We have a tremendous opportunity to connect our residents to economic opportunity. We know that starts with making sure that people have their essential needs met. So through our public benefit and income support programs, we provide eligibility and administer SNAP, TANF, Medicaid, child care subsidies, and a range of different supports that really connect into some of the work that happens with it at the Department of Employment Services to help people access and be prepared for jobs. And because what we know what our residents want who come to DHS is not only support with their basic needs to provide for their families, but they want economic mobility. They want to be able to provide for themselves and their children. We also administer a number of social support programs, the largest and probably most visible of which is homeless services, which has been really about reforming our systems of care so that homelessness is rare, brief, and non-recurring for DC residents. We've made tremendous strides in that space for families and are very hard at work on the reforms to our single adult system. So it's that's about helping people first, make sure that we have a response system to help them when they're in crisis, but also a pathway to a place of security from which they're able to achieve their goals.
Thank you, Laura. I appreciate that. Dr. Elliott, are you there? I know you were having some. Let's hold off until we can see her. Lupi, hello. Yes, please.
Hi, everyone. Good to be here with you. I'm Lupi Quinteros-Grady. I serve as the president and CEO of the Latin American Youth Center, a nonprofit organization that has been around for over 50 years and has been anchored in the Washington, D.C. area. We are a multi-service organization, provide various programming services to connect young people to opportunities and access to resources, from housing to we have wellness, to mental health, to academic support, to education, to workforce. So great to be here with you all.
Thank you, Lupi. Hi, Dr. Elliott. Are you
yes,
okay?
Good afternoon, and can you hear me?
Yes.
And I apologize, all of a sudden my internet wants to be unstable, but I'm Elliott. I have the pleasure of serving as the Chief of School Improvement for DC Public Schools. In that work, I lead a number of work streams that we consider to be equity levers for our district, which includes our school improvement work, our work around student supports, which includes our mental health supports, as well as health services for our students, student placements, supporting students who are experiencing homelessness or other significant transitions, as well as our work of really supporting what we consider to be whole child and anti-racist practices. So really digging into the science of learning and development, the impact of stress and trauma on the brain and learning. So honored to be here in part of this panel discussion this afternoon.
Thank you, Bren. I'm glad you got your technology squared away. It's good to see you. Okay, so first question for the panel. So if we look back on history, it's very clear that pandemics, they teach us a lot, right? And as devastating as they may be, there is a silver lining, right? They stimulate change, they stimulate innovation. So my first question for you is, how has the pandemic illuminated the important role that your organizations have in achieving health equity? And so not going to pick on anyone. I'll let you just dive right in.
All right. We actually, unbeknownst to me, that today we were going to actually talk, and you were the Dr. King, but you were the author of the study, where there's discussion about the impacts of COVID-19 in Ward 7 and 8. And so what we have learned at the Department of Employment Services is that we really have been economic first responders. And similar to Director Zeilinger, being on the front line the entire pandemic, helping people deal with the financial crisis that has occurred because of COVID-19. And what has opened our eyes is that, and we've always known it, but we felt it in a way that we had not felt it before, but without those key critical benefits and basic necessities that people have difficulty to survive. And I have to tell you, my staff and I felt it in a way that I have never felt it before. It has really been life-altering and life-changing.
I was just jumping. I mean, for the Latin American Youth Center, probably within the first 2 weeks of the pandemic, we were reinventing how we would conduct the work to outreach to our youth and families. There was definitely urgency, and one which I feel like we continue to really be at the forefront. And being in this space of, I've appreciated that we've been able to inform our partners and funders at times to discuss how to adapt services, and to also challenge at times where there was a disconnect in understanding what was happening on the ground in regards to the needs of our youth and families. I believe the nonprofit sector was critical part of the ecosystem. And I do believe that the CBOs prevented further devastation in our communities. I say this in a humble way because I believe we provided safety net, support, hope, unity, in a way where, because we were already on the ground, we were able to quickly mobilize, and we were key in connecting with communities since we already had that trust. And we continue to build that trust and continue to really look at how to create an inclusive community. And I say this because it was important for us and for our organization to make sure that our communities felt seen, that they were treated with dignity, and that we were able to mitigate as much as possible the isolation, which it's a health debt. You know, it's really created a lot of other issues, as we all know it, as it relates to mental health. So social exclusion and discrimination are social determinants of health. And so I think that really played out in our communities. We knew that there were disparities, but this whole pandemic really exacerbated. And so we were really just found ourselves in trying to quickly respond and bridge. We were a bridge, I believe, to a lot of different organizations, government agencies, from the school system to trying to connect to internet and to computers and resources that a lot of our communities not always had access to, even though that was being communicated, that was a resource available. Housing. We had about 80 young people, or 76 or so under care when this hit, and that's had to go and play in with the direction a lot of our government agencies as well in coordinating those efforts, as well as economic, and I mentioned mental health. So I was just really encouraged to see how our sector came together, collective efforts, and really understanding that we can't work in silos, and we had to really coordinate. We were very intentional about, you know, we already had partners, but it really expanded in a different way. I guess I shared the sentiments. What we saw right away was alarming, but we did work with the Capital Area Food Bank in DC, Prince George's, DC Diaper Bank, DC Central Kitchen, World Central Kitchen, No Kids Hungry, Man Up, Sardi's Restaurant, whatever we could do to mobilize and keep moving and putting food out there. And we're, of course, quickly fundraising unrestricted funds that allow us to get the resources to the door right away.
Thanks, Lupi. And we're going to talk a little bit more about collaboration and coordination of services in just a moment. So thank you for opening the door for that conversation. And Dr. Morris-Hughes, thank you for lifting up our work. We really appreciate the acknowledgement. It means a lot. It shows that our work is making a difference and informing practice and enlightening people. So thank you for that. I wanted to give Dr. Elliott or Laura any responses to that question?
For sure. And Dr. Elliott, if you want to feel free, it looks like you're about to jump in and
I'm happy to go next. Thank you. So I would say that, you know, one of the lessons that we learned is that our historically marginalized students and families are even more vulnerable during times of national crisis. And I think we knew that, but we didn't know how those gaps were exponentially exacerbated. Like, it's not just they're a little bit more, like they're exponentially exacerbated during a time of national crisis. And so our vulnerable families were often essential workers. So having a safe place for their students to continue to learn was even more important for those families. In addition to that, because family members were essential workers, they were more at risk for COVID exposures, which meant that their children were also more at risk for those exposures. And then finally, it meant that their employment was more vulnerable when their children were sick. So, you know, as we were looking to establish policies around cohort quarantines, that's what we did early on, that if there was a teacher or a student in a class that became positive for COVID, then the whole cohort had to stay home. We found that for many families, this meant, like, if I've got a pre-K or a young child now that doesn't have COVID but has to stay home because their classroom is closed, now my employment is at risk because I got to figure out how that child is cared for the 10 to 14 days of the cohort. So we had, you know, just so many things that were exponential gaps that were exacerbated for our vulnerable families that we knew were going to be bigger, but we did not have a sense of how large they were. And we just found there were many ways that the school district had to lean in, whether opening our schools for meal sites, vaccine clinics, supporting immunization compliance, providing space for childcare for essential workers, which is not something, you know, childcare is not typically what we do in our schools, but we had so many other things that we needed to support. And a big part of that was mental health support, not just for our students, but for our parents as well, that we're seeing all of these vulnerabilities and signals and symptoms from their students, and really during the early part when children were at home, not really knowing how to respond to that. So, we were, quickly putting together parent programs online through our Parent Academy to provide some resources that way, in addition to the technology and internet and those things. But we found like our role was expanded. So, when our school district talks about being a whole child centered school district, we had a chance to really be whole child centered, because it wasn't just about young people learning how to read and write and do, math. It was about, all of the parts that the whole child, the whole family, things that they needed in order to be successful, not only at school, but, to be able to thrive in their homes and in their community.
Thank you, Dr. Elliott. Before you jump in, Laura, I just want to recognize there is an echo, and our technical team is responding to that. They're working on it behind the scenes. For those of us who are on the panel, if we're not speaking, if we could put ourselves on mute, that'll be a big help. All right. Laura.
I knew Dr. Elliott should go next, because she was saying so many of the things that were in my thoughts, which is that there were a lot of things that we knew that were driven home in a very profound way. So in one area, of course, that when we had a stay-at-home order and we were asked to socially distance at home, that meant you had a home to do it in. And our residents without homes or in congregate settings already experienced a disproportionate prevalence of risk factors that put them at risk of very dire consequences should they contract COVID. We needed to have a way to very rapidly respond and control spread, and to communicate about what we were doing. So creating social distancing within shelters, opening up isolation and quarantine sites where if someone was showing symptoms, they could be in isolation while we waited for testing when we didn't have those same day tests that we have now. But also having non-congregate shelter at our pandemic emergency program for people who are highly vulnerable, where we could provide in hotels single room shelter or for people with risk factors. And we're still not done. We're not through. While we are in a different phase than we were in terms of our public health response, we are still very much in it. We have 500 people who are still supporting in non-congregate shelter because of the risk factors, and that they don't have a safe place that calls them. And I think our community also, the connection between of housing and health and well-being was felt profoundly when people were so focused on how do I cope with being home, and others did not have a home. And I think, and we've seen that increased funding, both from the federal government, by the mayor and our council, toward the housing that people need to exit homelessness. And I think that's no accident. And we also need more work to do. And I know we're going to talk about collaboration, we're only successful as a community. The government doesn't act alone. We act in partnership with organizations, with our residents. And we also need that people are more accepting of residents who have housing subsidies. So while we fund those solutions to help people exit homelessness, we are only effective if there are landlords who are willing to provide them access to a lease. So in addition to that, I want to also underscore what the other thing we learned to know, which is the importance of technology. We shifted all our benefit processing very quickly to being able to do that work remotely, so that people could file applications for public benefits online. And in our entire workforce, we were able to shift to be able to work remotely and process those applications for benefits. But people can only apply, they can only go to school, they can only access telehealth if they have access to a computer or some sort of technology and internet. And we saw great disparity there, and also a lot of energy to ensure that children and parents had access to that technology so that they could do online schooling, so that they could engage in services and supports. It's one thing to offer virtual services, but it's not really effective if people don't have a way to virtually engage in those services. So having to focus on all of those disparities, with technology, education, housing, food security, we felt so profoundly, and we still feel we are not through it. the economic catastrophe from COVID-19 is felt deeply in many communities, and those communities are going to take a lot longer to recover. And so we still need to realize that we are in an emergency response.
Thank you, Laura. And I feel like we have cracked the code on the echo because it seems much more peaceful right now. So I want to dig a little deeper into this. What I'm hearing is that, and we've seen this with many organizations, this pandemic has really caused us to pivot and think differently and operationalize and reallocate resources and rethink how we work, right? So can you provide a few more examples of what your organizations had to do at the height of the pandemic that proved to be, wow, this is really working, right? For us in healthcare, it's been telehealth, right? This proliferation of telehealth, it's working. People are having meaningful exchanges with their providers. But unfortunately, it took a pandemic to make this happen, right? So my question for you is, what is it that you've done and what's happening in your organizations? What did you have to do differently that's proven to have benefits that has changed the way that you will move forward and how your work is executed?
At the core of the pandemic, in my opinion, or at least in my work, has really been the implementation and the operation of the unemployment insurance program, which quite frankly is not nimble. The District of Columbia, like many states, have systems that are older than us. Use the original computer programming language in at least 2/3 of the states across the country. And so when it came time to send everyone home, and I remember this day, March 13th, I was in the office the next day because we did not have the infrastructure to pivot. Historically, in my agency, we have hired many people from the communities that we are serving. And so we still had IT infrastructure challenges. I could send people home, but they didn't have technology at home. They didn't have Wi-Fi. We were still operating on desktops and PCs and not laptops. And so we had to become very nimble very quickly. We had to scale up very quickly, and we had to be able to adjust to policy changes in a way that is probably once in a lifetime. I mean, in the course of the year, I had 60 policy changes that I not only had to train my staff on, but I had to train the general public and then somehow modify systems to be able to implement this. And so the lesson learned for us is that we had to change the way that we think. Our operation was so dependent upon human interaction that we had really prided ourselves, and as part of our own agency's strategic focus and operations, it had really been driven on human-centered interaction. And we had to shift that for better or worse, right? And so we had to change the way that we think and approach our work. We focus more on efficiency and less on that human interaction. And then I had to build some competencies amongst my staff that we had never really addressed before, like understanding policy and statute. Understanding we have had so many statutory changes that I literally had to shut down the agency for a day just to go through all the statutory changes and make sure we can put that in language that was digestible to the general public. And it is a completely different way of thinking for us. We had not thought that way. We had not interacted with the general public that way. Now, one thing that I would not change and has reinforced my thinking is continuing to hire and recruit from the community. Because what I've learned is that in the time of crisis, we were able to communicate and interact with people who have the same lived experience. And that makes a difference when you're in crisis, when you have the same lived experience and you can coach and walk someone through, the economic crisis that they're in. So I would never change that. But now I know how to train and scale up quickly. And we now have a focus on being efficient and nimble.
That's a great example. Thanks for sharing that. Perfect example. Anyone else want to add how your organizations have changed and you're doing work differently and it's going to be sustained?
I mean, I think similar to what was mentioned, the infrastructure had to be worked on around the IT and making sure that connection was happening. And it was really crucial because it was a lifeline to our communities and trying to make sure we were reaching out. I think, right away, we also reached out to our communities. It was sort of mandated from day one. We're calling everyone that's in our roster, our universe of 5,000 families, to understand where they are, where their needs, and to in real time learn what was happening. And that was translating to ours being able to adapt and then make the changes necessary. Like we were creating weekly data reporting. We were calling, and it was really interesting too, because listening to our communities is critical. Our families were providing for each other, and so when you go from that and you have no buffer, and all of a sudden there's no cushion and no way for you to provide food, basic needs. It was a lot of layers there. I tell the story of our staff calling a father who first call we're good, second call we're good, third call he broke down and was like, I need help. Like I can't, like our communities were grappling with like what's going on, and just like we were trying to figure it out, we're trying to understand like what happens here, like how do I provide. And so this is why I refer to treating our families with dignity. Like, right, we were calling, we were gently asking, and that was really continuing to inform our work. I said too that the partnering was so key. It was no way we could have done what we did without the partnerships. And it was a 5 organizations that came together: Birth for the City, Mary Center, LNYC, the collaboration. And it was to do that through DC events, that together with 2 cohorts, we've been able to put $13.2 million out there for rental assistance to families that weren't able to access support and so forth. And then I also say in coordination with government, Laura mentioned, we were getting guidance from them as we were trying to understand how to deal with the young people we had in housing. They were creating protocols in real time. And we were sort of looking for that guidance as we were trying to understand how to keep our staff safe. And so a lot of the guidance that was coming from them was on point, because it was really like, just coordinating those efforts and paying attention. So I think learning those lessons about how valuable and the expertise is in different sectors and sort of relying on each other, you had no choice. You had to do it. And I think that was something that, we found that we had to talk to each other. We never closed our doors. So the after school programming, first, our staff were really just anxious about how would they stay connected with you, because this was emphasized. We will stay connected. We will figure this out because it is critical. It is a lifeline to our communities. And so when we did this, the creativity that came about in the reach of being able to have after school programs, the things that we saw from graffiti to, poetry we didn't miss a beat. And so for us, it was just trying to create that space for youth at a time where nothing was normal. And still we're not there. But I think, just being able to really rely on each other was something that we were able to do. And definitely, I would say too, what was already mentioned too, having to really pay attention to the coaching, the staff. They were in a very different space. And I think that this is something that we're still having to monitor as we also see the mental health around the communities we serve, but also the staff that are in direct service and the toll that this work has taken. I know the school system is feeling it. I know that everyone that's been in direct service is feeling it. So having to really still manage and sustain this is something that, that we have to continue to, as direct service providers, frontline workers, whatever, essential workers, continue to really manage so that, this great resignation that we have is affecting us and how we're trying to bring talent into our organization. And it's really also us having to really be creative about what we need to do to continue to be flexible, but at the same time be able to pay attention to our staff so they can be whole and do the work that they need to do to support our communities.
Thank you, Lupi.
Sorry.
Laura, did you want to say something?
Yeah, I'll say there's probably about 4 things. One is that we started several years ago with a whole family approach in a lot of our family service deliveries, meaning that we're looking at the needs of parents and children, so caregivers and children, understanding that the mutually reinforcing benefit when parents are able to focus and do well, when their children are okay, when parents are thriving and doing well, it has a positive impact on their children. We have to look at the family as a whole and not just in pieces in the way that we provide integrated services, which was, we knew it and we began doing it, but we took it to a different level and I think are sustaining it differently now. Like at the Department of Employment Services at DHS, we had to rapidly shift to be able to do all of our benefit processing and allow people to do all of the work that was needed related to sustaining their benefits in both by telephone or online, and we were able to maintain that capacity, which we think is which we've been striving for that, but we were years away from it. We were able to fast track that, and we think that improves our customer service. We absolutely will keep that, and I agree fully that just like with telehealth and the flexibility, being able to meet people where they are, sometimes it is better and easier for people to engage from home without having to go in and meet with a caseworker in an office, to be able to go into a TANF employment program, sit in a classroom versus what they can do online, and they may be more able and likely to participate and receive that benefit. So really putting the voices of our customers at the front continues to be really important. And I think that was 3, I hope, but the 4th is also sharing information, listening, and definitely hiring from community, but also making sure that we are proactively putting information out. We were having weekly and then bi-weekly and updates on all of the different changing guidance as the situation was changing. And that was something that I think was really important and well received from our stakeholders and supported the providers as well.
Thank you, Laura. I was afraid this would happen. It is 2:10. We have 10 minutes left. We just need more time. But very quickly, we've touched on this a little bit, but the pandemic has underscored the importance of working together, right? We cannot continue to operate and function in silos. And historically, the systems and the structures and the funding mechanisms have a tendency to force organizations to work in silos, right? And so my question for you, and we know that health equity is complex, it's intersectional, right? So it requires collaboration. So the question for you is if your organization are making progress in this space, if you can share some examples. I think many of you have already done that. But if you had a magic wand, right, what needs to be done to facilitate cross-sector engagement, coalition building, and coordination of services? What will do it? And we'll just take 2 responses on this question. If you could make them brief, that would be appreciated.
Sure. Well, I would just start by saying time. Like, time is the thing, and that's probably one of the resources that we had the least amount of during the crisis, because we had so many things that we were trying to do simultaneously. So I think like the time to really co-create solutions, and I think some of this we're able to do it based on our lessons learned. We're realizing where there were gaps that we needed to have more engagements from other partners. So we need that time to really hear each other's point of view on issues, to understand the assets and limitations that folks have based on the work that we did to accomplish. And then, like, how do we collaboratively approach those solutions, centering the needs of our most historically marginalized families? So we know it's not going to be one, size fit all. I would tell you there were I say that about time, but then I also want to also say that the pandemic forced us to create that time. Like, we would just be tagged on a meeting, like, be here with these other agencies so we can plan this together. And so some of that forced collaboration was great as well, because we had a limited time to get something done really quickly, and we all needed to be at the table. And sometimes, schedules and things don't allow for that. I do believe that technology and, Zoom or Teams allowed us to be able to get together more quickly and more efficiently, which was very helpful. And then the final thing I would say is, with that opportunity to co-create, it allows us not to create parallel solutions, which I think is, I think we would all agree, sometimes just waste resources if we're all trying to tackle the same thing and not really understanding what are the resources that are already in place.
Thank you, Dr. Elliott. I'm looking in the chat, and I just want to lift a few questions. There's one question, and this may be appropriate for the Department of Employment Services, but what could be done to address possible hazard pay and/or insurance that businesses, organizations, and government provide precautions and protocols that truly do look out for low-wage frontline workers in a racially equitable way?
Ooh, okay. So let's back it a little bit. Let's start with the hazard pay. So let's not start with hazard pay. Let's unpack how health or safety and health conditions of workers is really a civil rights issue, and I view it as such. One of the things that I don't have an opportunity to talk about as much as I'd like to is the work that we do in my Office of Labor Law and Standards, which is enforcement. I have people on the ground as we speak in the community, making sure that the work that they are doing in construction sites or in kitchens or in childcare facilities are not only safe, but the people that they're interacting with are also safe. And historically, lower waged workers have been ignored in that space. And so it is a civil rights issue for me, and something that I've been more focused on during the pandemic, when we were in a state of an emergency, and all caution was kind of thrown to the wind, and we had people who were doing whatever they needed to do to survive. It was important to me that we protected them as they tried to make a living for themselves and their family. Now, as it relates to hazard pay is a bit complex because we're really, and we have been in 2+ years of a pandemic that has not gone away. And this has become our new norm. And so there's a lot of discussion about whether or not hazard pay is needed, given that this is our new norm. And if there are other changes in conditions that trigger the need for hazard pay. And obviously, hazard pay in the private sector versus public sector is different. And it's also different by industry and position. And so there are a lot of differing opinions and views on how hazard pay should be treated. But what I can say, regardless of where you land on hazard pay, being fairly compensated, and hear me out here, because that is the core issue. Because many people aren't compensated fairly, and we know that minority populations earn less across the board. than other subgroups in our labor market. Being fairly compensated is really the core issue before you get into whether or not you're being correctly paid for hazard pay or should you receive hazard pay. That's why this is a social justice issue, because it's really about fair wages and pay regardless before you even get into hazard pay. So I don't have a specific opinion other than at the Department of Employment and Services, we continue to support all workers, and we're going to keep pushing the envelope and hopefully supportive of policy that's going to make sure that there's equitable and fair pay, especially for district workers that are in historically lower wage and paying jobs.
Thank you so much. So we have 3 minutes left, and I always like to wrap up on a positive note. So this is a question for each of you. What gives you hope about our city, right? What is it that encourages you, that's inspiring you, that motivates you to wake up each and every day knowing that a brighter future is in store for Washingtonians, regardless of race, income, socioeconomic status, and all other social identities?
Hopeful about the ability for our communities to come together in the time of crisis. And that transcends gender, race, occupation. I mean, people have just come together and rallied around helping each other. And it is reassuring, and it warms my heart to know that at the end of the day, we still have people that just care about being a good human being. And that gives me hope.
Thank you. Thank you.
I would say for me, definitely our youth. They are very resilient. I mean, this is a challenging situation for everyone, but our young people, it just, they never cease to amaze me and how incredible they are. I mean, we just created opportunities for them during this time, and they excel. We had young people still not stop and get their GED, or still try to, get a certification, still try to, stay optimistic as much as they could with very challenging circumstances. So I was just really, and just yesterday I attended an event where we had 10 authors, youth, write books. There are actually books that are going to be with Creative Apple and Shoutmouth Press. And so like to see that creativity during this time, I just been filled with some hope and light, which is something I need to hold on to.
I would agree. Our students, our families, and this collaborative spirit in DC. What a resilient city! Everybody pitching in. We have young people who are encouraging us to stay strong. We can make it. When they themselves and their families are faced with really challenging situations. So just the resilience of this community and each individual person, particularly our most vulnerable families.
And being in the capital city over the last 2 years, we've seen, and we have also seen that there are shared values and recognition that we have a long way to go to achieve the kind of equity that would align with what our stated values are. And I think there's more willingness to take action and to do the serious hard work to get there. And it is a lot of very hard work to create a lot of very fundamental change. So I started by saying that we're on a social justice mission, and I said that today in my own introduction of myself to my staff at DHS, that's not a new thing, but the recognition of what it will take for people to have meaningful access to opportunity. I think there's more clarity around defining that problem in a way that we can solve it.
Thank you, Laura. I appreciate that. So we've come to the end of our time together, unfortunately, but I just want to thank each of you for taking time out of your busy schedules to engage and contribute to this dialogue that I think is another milestone to us creating a city in which all people can achieve their full health potential. To the audience, thank you for participating in your engagement. You work just as hard as everybody else and making sure that we have a brighter future. And we thank you for your engagement. And let me read what I have to read because there's lots of guidance here. Before we close this particular session, we next have 2 concurrent sessions on the futures of health and racial equity, moderated by district leaders at the Office of Health Equity and the Office of Racial Equity, respectively. Be sure to tune in to continue the conversation about how we will build an equitable post-pandemic future after this 10-minute break. And now it's 8 minutes for us. So thanks, everyone. Take care. We'll see you in the next session. Thank you. Bye-bye.